Hello everyone. Today in this video, we are going to discuss about one of the rarest cause of congenital cyanotic heart disease with increased pulmonary blood flow. That means plethoric lung with cyanotic heart disease, that is persistent truncus arteriosus. So the incidence of this persistent truncus arteriosus is less than 1% in children. So it is very rare condition. What happens in this condition? Normally, the heart is divided into four chambers. As we know, this is the right atrium, this is the right ventricle, this is the left atrium and left ventricle. And from the right ventricle, the pulmonary artery gets out, and from the left ventricle, aorta gets out. But during the embryological period, these two, pulmonary artery and aorta, is merged with each other, and during the embryological process, it is start with a small tube that is called truncus arteriosus. After few days of cardiac tube formation, this is divided into two parts. One is goes to form aorta, and one is goes to form pulmonary artery. So this is the division is there. But if during the embryological period this division is failed to occur, then there is a one single tube is there, one single vessel is there, that is called persistent truncus arteriosus, and that means this pulmonary artery and aorta is combined to each other in a single normal lumen, and so blood from the right ventricle and from the left ventricle goes into one single vessels, that is called truncus arteriosus, and from this it is goes to give the aorta, and from here there is a pulmonary artery is formed. So blood is mixed in these two areas. So right there is presence of VSD. So blood is getting mixed due to the massive VSD. Blood is getting mixed in both the two ventricles. The deoxygenated blood from the left ventricle and the deoxygenated blood from the right ventricle get mixed, and this mixture of blood is getting enter into the truncus arteriosus. From here blood is going into the pulmonary artery, and then rest of the blood is going into the aorta. This is the main pathophysiology of truncus arteriosus. So what is the main pathology? As I say, the all both the ventricle gets drained into blood into a single tube, that is called truncus arteriosus. So the deoxygenated blood from the IVC and SBC enter into the right atrium, and the deoxygenated blood from the lung enter into the left atrium. This blood from the left atrium, blood enter into the left ventricle, and from the right atrium, blood enter into the right ventricle. And there is a massive VSD in every most of the patient of pulmonary truncus. Most of the patient with persistent truncus arteriosus having massive VSD. So it look like a single ventricle. So there is a complete mixing is there. So oxygenated blood and deoxygenated blood get mixed, and this blood enter into the truncus arteriosus. And from here there is a present there is a origin of pulmonary artery. So this mixed blood enter into the pulmonary artery and then get purified and oxygenated, and then gets into the left atrium, and rest of the blood enter into the aorta to supply the patient body. So there is a cyanosis since birth, as there is a complete mixture, and this cyanosis is depend upon the amount of pulmonary blood flow. If the pulmonary artery flow is less, then there is a less amount of blood get purified, oxygenated, and there is a increased cyanosis. If the pulmonary artery flow is much more, then the chance of cyanosis is less. This is the pathophysiology. Now, there are different types of persistent truncus arteriosus. According to Poulet and Edward classification, it is divided into four types based on the type 1, 2, 3, 4, based on the origin of pulmonary artery from the truncus arteriosus. So, the origin of the pulmonary artery is on the basis of origin of the pulmonary artery, which is divided into persistent truncus arteriosus is divided into four types. Type 1 is in which there is a massive VSD is there, and the pulmonary artery originated from the truncus arteriosus, and this truncus arteriosus continuous with a as just like aorta. In type 2, the truncus arteriosus is continuous with a aorta, just like aorta, and the left and right pulmonary main pulmonary artery is originated from the posterior surface of the truncus arteriosus. Now, in type 3, the right and left pulmonary artery originated from the side of the truncus arteriosus, and in type D, the pulmonary artery is originated from the descending aorta, and it is just look like a top, as because the flow is less. So this is the different types of truncus pulmonary persistent truncus arteriosus. Now, one other classification is Van Prague classification based on the presence of VSD. So it is type A and type B. Type A means VSD is there, and type B is no VSD is there. And type A is divided into four types: type A1, A2, A3, A4, and these different types based on. So this is in type A1. It is just like type 1 in Collet and Edward class, just like Collet and Edward classification, in which there is a massive VSD is there, and the pulmonary is originated from the common truncus arteriosus. In A2, the pulmonary artery is originated from side of the truncus arteriosus. In type A3, the one of the pulmonary artery is originated from the common truncus arteriosus. Another pulmonary artery is originated from the arch of the aorta. In type 4, the both the pulmonary artery is originated from the common truncus arteriosus, and there is a interrupted interrupted aortic arch is there. So there is the interrupted aortic arch is there. So this is aortic arch is one, and there is the interrupted aortic arch. So in type 4, this is the most severe type and most difficult type, in which there is a interrupted aortic arch is there. So this is Van Prague classification, and also you have also this persistent truncus arteriosus. Teich's syndrome is mostly associated with this type of persistent truncus arteriosus. In most of the cases, there is a interrupted aortic arch is also seen, and right aortic arch is also seen in patient with persistent truncus arteriosus. Now the classification, clinical features. The clinical features is depend upon the amount of blood flow through the pulmonary artery. If cyanosis is depend upon the, as I say, amount of pulmonary blood flow. So if the pulmonary blood flow is much more, then the cyanosis is less. As the pulmonary blood flow is much more, so there is a increased amount of blood into the lung, and this causing a right heart failure. So patient may present with small amount of cyanosis with right heart failure or left heart failure or congestive cardiac failure if there is a increased pulmonary blood flow. But if there is a decreased pulmonary blood flow due to the decreased pulmonary due to the stenosis, like in type 4 type A4 or type 4 type of persistent truncus arteriosus, there is a decrease as the pulmonary blood flow is decreased, so there is a small amount of blood get deoxygenated, and so that's why there is an increased chance of cyanosis, and the patient may present with severe cyanosis without heart failure. Now the treatment part. Before going to the treatment of persistent truncus arteriosus, the diagnosis is done by echocardiography, and every patient we have to do cardiac catheterization to see the carotid artery origin and coronary artery origin. Now the treatment. Before going to the surgical treatment, the medical treatment is, if the pulmonary blood flow is there, so we have to decrease the pulmonary blood flow by giving and decreasing the right heart failure by giving the furosemide, that means, and diuretics to decrease the preload, and also AC inhibitor to decrease the afterload also. So this is the medical treatment. After the medical treatment, surgery is always needed, and surgery is emergency situation. In type 1, type of persistent truncus in type 1 type of persistent truncus arteriosus, as this there is a in type 1 there is a Rastli operation is there, and we cut the right ventricle, and we also cut the common truncus arteriosus, and we make a conduit with right ventricle and we attach it with a main pulmonary artery, and the common truncus arteriosus is get attached with the left ventricle. So this is the type 1 treatment. In type 2 treatment, type 2 or type 3 type of truncus arteriosus, the treatment is this area is cut and this is attached with a conduit with, and this right ventricle and pulmonary artery homograft is attached with the left ventricle and right ventricle, and left ventricle is attached with the aorta. So this is the treatment. Thank you.